Irritable bowel syndrome, or IBS, is one of the most common diagnoses made by gastroenterologists and primary care providers, but exact cause of IBS is poorly understood. I'm Dr. Farshad Elmi, a gastroenterologist with Premier Medical Group, and I would like to help you understand IBS. 1 in 5 Americans has IBS, and it is more commonly seen in women. IBS is also known as irritable colon, spastic colon, and nervous stomach. So, what is IBS? Irritable bowel syndrome is a functional disorder which affects the gastrointestinal tract. The GI tract is structurally normal, but it may not function as it should. There is a layer of muscles in the GI tract. These muscles contract and relax in a coordinated, rhythmic fashion. These rhythmic contractions move food through the GI tract from the esophagus down to the rectum. These contractions sometimes become more intense, leading to a spasm which creates abdominal pain. If these contractions slow down, you can develop constipation. If they speed up, you can develop diarrhea. It's not unusual for people with IBS to alternate between these two. Patients with IBS could also have a more sensitive GI tract, which is called visceral hyperalgesia. Because of this condition, normal movement of food and gas through the GI tract may be perceived as pain and discomfort. Common symptoms of IBS are cramping, abdominal pain, bloating, excessive belching, and increased abdominal gas. Despite these uncomfortable symptoms, IBS does not lead to permanent injury or loss of function. Although irritable bowel syndrome can cause significant disturbing symptoms, the majority of patients are able to control their symptoms and live a normal life without developing serious health problems. Most patients with IBS find that symptoms improve as they learn more about their condition. In many cases, we can control the symptoms by modification of diet and lifestyle. The most important objective is to get the correct diagnosis. Several other gastrointestinal conditions produce similar symptoms. There is no single diagnostic test to diagnose IBS, and before making the diagnosis, other GI conditions should be carefully excluded. It can be difficult to differentiate between IBS and other conditions such as inflammatory bowel disease, celiac disease, and so on. If you have any ongoing GI symptoms, you need to see a gastroenterologist. I invite you to explore our website for treatment options or make an appointment to see me.